my name is Deborah and I'm an occupational therapist. I'm going to be talking about the Configura Comfort Rise and Recline and the postural support options. When prescribing seating, we are always aiming to achieve a well-supported, good upright position in a chair. The size of the chair can impact greatly on this. Just by having the correct seat depth, seat height and seat width, we can accommodate a person's posture and enable them to maintain a good position in the chair. However, due to various medical conditions, it may be that the person has a tendency to lean to one side or lean forward, and we need to provide additional support. Without that additional support, the person's ability to breathe and digest can be compromised. In addition, it can increase the risk of pressure build-up in certain areas and increase the risk of contractures, all of which we want to try and avoid. The Configura Comfort has a tilt and space mechanism as well as 3 different backrest support options. With the tilt and space, the backrest and the seat base angle remains the same. However, just the shift in weight can enable a person to maintain a position in alignment and reduce the risk of them leaning to one side. As you can see that here. However, that may not be adequate, and it may be that they need additional postural support. With the waterfall backrest, we can accommodate some of the person's postural needs by removing some of the stuffing or readjusting the stuffing within the cushions. We can remove the cushion, open the zip, and here the stuffing can either be removed or positioned according to a person's needs. I can move this to this side to provide more support. I can then replace the cushion. However, that may not be enough, and we may need to provide a little bit of a prompt. We can do that by providing these lateral wedges. Just by having that on the side, it can give a person a little bit of a prompt and enable them to maintain a good position in the chair. But it may be that they need a little bit more pelvic stability, and so we remove these cushions and we replace it with a lateral support backrest. As you can see here, we have additional support by the pelvis to provide that stability, and that in itself can enable a person to obtain and maintain a good upright position. However, they may need support in other areas, and so we would remove this and put in place an adjustable lateral support backrest. The adjustable lateral support backrest works in conjunction with little lateral wedges. These wedges can be used to manage a person's posture because along with this backrest, they do provide a great deal of support. Now, these can be fitted on either side of the backrest, or we can position them on one side if the person only requires support on one side. The idea is that you can provide the support exactly where it is required. This, in conjunction with the tilt and space mechanism, can make a huge difference to maintaining a person's posture. The last consideration is for those with a kyphotic spine. When someone has a kyphosis, the apex of the spine can protrude significantly, and what we want to try and do is accommodate that. To do that, what we can use is the waterfall backrest in an alternative position. Instead of having them in the normal position, we would put them in a vertical position, and this allows us to leave a gap here for the spine. Now, usually when the spine is compressed against the backrest, it can really increase the risk of pressure injuries occurring. However, with this setup, the pressure is distributed amongst the whole of the back and actually reduced against the spine. This can make a huge difference, not just with comfort, but actually with enabling a person to obtain a much better position within the chair. You can then use the headrest support as required. Once again, removing as much or as little stuffing as you need to enable the person to be comfortable. Thank you for watching.